All right, so I have 1:15 straight up. We will go ahead and get going. So welcome everybody to our weekly news briefing on all things COVID-19 for the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll begin with opening comments, first from Mayor John Hamilton.
Thanks a lot. Good to be with you all again. Just a quick local city government updates. We had one new employee test this week positive. That's down from 4 and 2 the last 2 weeks, so we're pleased with that. I don't have the City of Bloomington utility results back yet. That lab is still doing those. And our $100 benefit is still at 63% of our eligible employees. So we're hoping to see more movement there. You all know there's some hope looking at the state data. We talk about that data, and there's some indications of improvement statewide in cases and deaths. It's too early to know if that's a trend. We've seen these bumps before. I will say, our county, the only county in the state with a mask mandate, I believe, is still one of only 3 counties in yellow in the better status, which is reminding us the importance of what we're doing. Our cases per 100,000, I know you'll hear this, what they are locally below 200 again, which is good. But just as a reminder, the immediately surrounding counties are still at 300, 500, 600 cases per 100,000 compared to ours below 200. So we're definitely an island in a way, but really important. And thanks to all who are doing that. The big news, of course, was really the federal plan announced yesterday, a major effort to require mandate vaccinations or testing among about 2/3 of the American workforce, covering 80 million employees. Those who are at establishments over 100 employees required to get vaccinated, or weekly testing on the way. All federal employees and contractors, all health facilities receiving Medicare, Medicaid, about 17 million workers covered there. Serious efforts on public schools urging that they be supported in requiring vaccinations for staff and masking, et cetera. And then more support for masking, masks and supplies and tests and treatments and other things. So that statement was huge and very clear statement from the federal government about the danger and the loss that we face from 80 million Americans who are not getting vaccinated, about a quarter of those who are eligible, that it's just really damaging our country and our future, and that those steps have to be taken. So I want to thank again locally the steps we take that I think have been so important, and acknowledge this very important statement that came from the federal government this week to try to move us forward, recognizing it's going to take some significant changes. So I congratulate them on that and look forward to working and seeing that happen locally too. Thanks.
Okay, let's check in with the Monroe County Department of Health and Penny Caudill.
Good afternoon. Today I want to begin with vaccines. So thank you for that segue in terms of why that's important, Mayor. As of today, we have 59% of those who are eligible have been fully vaccinated. So we're creeping closer to that 60% that we hoped we would get to earlier this summer. And if we are at 60%, next week, I think I'll do a happy dance just because we've hit that mark, right? So please consider being vaccinated. Vaccine does continue to be available in many places: pharmacies, provider offices, the public health clinic on Miller Drive, sites across the state, and various outreach clinics. Currently, we also have school clinics scheduled over the next few months. Right now, we are offering first doses of COVID-19 for those who are eligible, and then later we'll return for those second dose appointments and flu vaccine. Usually, those school vaccine clinics are filled. People utilize them very well because it is much easier on families. They don't have to take off, make special appointments. It's easy to get their family protected. Unfortunately, we are not seeing many requests for this first dose of vaccine in these school clinics. Now, that can be, I'm sure many people who wanted their children vaccinated right away did that as soon as they were eligible. Some people may be waiting. Some people may just not be interested. But if you were one of those parents, one of those teens who were waiting to see what happened, now's your time to get vaccinated. We know that this is a safe and effective vaccine. Vaccines are available at those clinics to students as well as to staff. So we vaccinate as well to help protect those students who are under age 12 and cannot be vaccinated. So if we can surround them with protected individuals, that is protection around those students. If you are interested in having your students vaccinated, but you have missed the information, the consent forms, you haven't seen that come home or in your email box, please contact your school. It's possible that the information is coming closer to your school's clinic and just hasn't went out yet. It's also possible that it went out and didn't make its way to you fully. We know that that sometimes happens, even though I know it's hard to believe. So contact your school if you are waiting for that. Third dose vaccines for those who are severely immunocompromised are available. Contact your provider or go to ourshot.in.gov to schedule that third dose appointment if you are among those eligible. In terms of booster doses, which we're hearing a lot of talk about, that those have not yet been approved. And those are the doses who are for people who have already received their first 2 doses of vaccine, but we're concerned that the immunity may be waning. And so the third dose for them, that booster dose, is intended to boost their immunity back up. So we are waiting on approval for those, on the recommendations around those. When is it appropriate to give that other vaccine? And once we have all of that, the approval's done, we have the recommendations and the directions, then we will be able to provide that booster dose. But at this time, that is not available. We do continue to have Moderna Mondays and are expecting to increase and expand hours as we come into fall. We expect to add Pfizer to that list of options as well. We will have vaccine at the Fiesta del Antonio event on September 18th from 12 to 3. We will have vaccine available at the 50 Plus Expo at Switchyard Park Pavilion on the 22nd from 3 to 6 p.m. And we continue to look for other outreach events where we believe we can reach a large number of people. Visit ourshot.in.gov for a full list of places where vaccine is available. The vaccine is free to you. Now to testing. We've been talking the past few weeks about testing and reopening the community site, and I want to tell you that that is still happening, but it is still pending. We've made some progress, but we do expect some changes from our original plan. So we're disappointed that it's taken so long, as I'm sure you are disappointed as well. But we have been assured that this wait is going to be worth it. As soon as we have the details, we will be sharing them. Whether it's midweek or it's, on Friday, we will make sure to get that information out. For now, visit coronavirus.in.gov, go to testing sites. You will see a link and the map for all the available testing sites throughout the state. I know there's a lot of interest in rapid testing, and most of the state testing sites, community sites, do have some rapid testing available. So, get that appointment if you need it. Use that state map to find the closest location to you. Advisory, our current advisory, as the mayor mentioned, that we are one of 3 counties currently still in yellow at 1.5. Community spread does remain high at 181 infections per 100,000 and a positivity rate of 5.06%. If you are symptomatic, please isolate and arrange for testing, even if you are vaccinated. If you are a close contact to someone who tested positive, If you are unvaccinated, you need to quarantine. And that means staying home and away from other people because you may become infectious at any time. And that may happen even before symptoms occur. And then you can arrange for testing. 14 days from last exposure is still the gold standard for quarantine, although there are some options for 10 or 7 days with added precautions and testing that's negative. If you are vaccinated, then you don't have to quarantine if you're a close contact. You should wear your mask, and the recommendation is to get tested after 3 to 5 days of exposure, but you do not have to quarantine. Testing after 3 to 5 days, as I said, is recommended, and then you follow based on those test results. Isolation and quarantine is vital to limiting transmission of this virus. Schools and quarantine. The Indiana Department of Health has provided for an option for schools regarding quarantine, but in order to use this new option, the school must have complete and thorough mask compliance. So schools may or may not choose to use that option, but again, if they do, it requires full mask compliance. And finally, the Board of Health decided to postpone any decision regarding the current health regulation until September 22nd. They felt it was too early to make a decision based on the numbers and the data, and they want to reevaluate that in a couple of weeks. The current order is set to expire September 30th. So by meeting on the 22nd, the board will have time to make any revisions. If they want to extend it, they can do that. We can make any revisions that they decide they want to make if it's being extended, and still have time to get that to the Board of Commissioners, because it would have to be approved by them to go into effect. And after this, I will take questions. Thanks, Chuck.
Okay, let's check in with the Monroe County Board of Commissioners and Julie Thomas.
All right, good afternoon, everyone. Thank you all again for being here. It's lovely to see everyone today. It's a good time to remind folks to sign up for the resident alert system, which we utilize to send out information about things like health orders or testing sites. So please sign up for that. Just go to co.monroe.in.us, click on the megaphone, follow the directions. It's pretty simple. You can get text, phone, and or email alerts. Also, just a reminder to our residents that while the governor's order is still in effect, that we, as the Board of Commissioners, have worked with the County Council to provide township assistance funding for folks who are struggling to pay for the basic necessities of life, like rent and utilities and other things like that. Please contact your township trustee. Every county resident lives in a township, so please contact your trustee for more information. They also have other resources available to help you. And just a shout out and a note of appreciation from the board to everyone who works in healthcare, and for the great work that they're doing and the stress that they continue to be under. Thank you to our essential workers and all of those who have been vaccinated, and especially those who continue to wear masks, whether they're vaccinated or not. So thanks to everyone, and we'll take questions.
Okay, next to IU Health and Brian Shockney.
Thank you, everyone. I also want to thank our local elected officials, Indiana University, and most importantly, our county health department for their leadership and decisions they've made over the past 18 months. We do not take this for granted as a healthcare organization, and know that what we have faced and are facing would be dramatically different without these bold decisions and support. Thank you so much. I'd like to start by reiterating the importance of vaccinations during this time. The COVID inpatient surge we're currently in is made up of predominantly unvaccinated individuals. As healthcare providers, we're here to help people get better, and we would love to provide you with a vaccine instead of a hospital stay. Our COVID-19 inpatient census in the South Central region may have achieved a peak over the past few days. As the mayor was saying, we're hopeful. It still remains high and at a high level, and it continues to require us to reduce our other services to ensure care for these sick patients. Here in Monroe County, between IU Health and Monroe Hospital, the numbers of COVID patients seem to be declining at a faster rate, And I solely believe this is because Monroe County has a higher vaccination rate than those of our other counties. When you go to the first slide that was up there, it is all of our IU Health hospitals in the South Central region, which is a much higher rate. And I will say that the number of inpatients in our Bloomington Hospital is now at the same number and sometimes less than the total of the other hospitals in our region. So it truly is a county and regional issue, and our vaccination rate here in Monroe County is helping us save lives in Monroe County. Of the COVID-19 patients we currently have in the region, approximately 90% continue to be unvaccinated individuals. And we do not have, as the graphic shows, any vaccinated COVID-19 inpatients in our critical care or on a ventilator. Critical care beds remain a point of concern across the country and here in Indiana as well. According to the Department of Health and Human Services, only 18.9% of critical care beds in the US are currently available. This is down from last week. This national data continues to mirror what we're seeing here in our own counties and region, with 16.4% of critical care beds available in Indiana. And that is a decline of available beds from the previous week. We continue to see a high volume of emergency department visits across the region, where we've seen some record-setting days for the volume of individuals seeking care in our emergency departments. As our healthcare systems are overwhelmed right now from the care of COVID-19 patients, it's important individuals seek the right level of care when it's needed. So we encourage people who are having a life-threatening health issue to go directly to the ED, call 911, do all the things that you're taught. But some of us come to the emergency department not necessarily needing to get that level of care. And so in this graphic, we've shared this a few times as our social media team has posted, and we put it out over the several weeks here. Getting the appropriate level of care can save you time and money while ensuring emergency medicine resources are reserved for those who truly need them. With that, I want to thank you for continuing to do your part in helping us to get through this 2021 surge by getting vaccinated, wearing your mask, doing all the things that Penny has said and said again today, and physically distancing when you may be at risk of the physical space of others. I'm happy to take questions at the end.
Okay, let's next check in with Indiana University and Kirk White.
Well, good afternoon, everybody. We've got some good news to report on the campus this week. Really, our positivity rates have dropped significantly. When we reported last Friday, we had a total of 91 positive cases at IU Bloomington. This week, that's down to 63, with 52 of those being students and 11 being faculty and staff. So the infection rate at the campus has gone down, and we're very pleased about that. At the same time, our vaccination rate continues to improve. We went up 0.4 of a point, almost 0.5%. Last week, we were at 91.8, and this week we're at 92.2% on the campus. And so we feel very good about the trend where we're headed for this week. A couple of other items. We are following up a significant number of students who came to us in August, needed vaccinations, and so it's time for their second doses. So next week we'll have a clinic Monday, Tuesday, and Wednesday alongside the same location as our testing site. That's Gym 171. And this is for IU faculty, staff, and students. We'll have a vaccination clinic during our normal hours, and Amanda has put those in the chat. So this is the Moderna shot first, and if you need a second, or if you just need your first Moderna, this will be next Monday, Tuesday, and Wednesday. The hours are there in the School of Public Health, Gym 171. Just walk in, you don't need an appointment. So we're continuing our efforts to kind of buttress the resources in the community for for vaccinations with this additional push here the next 3 days. And finally, we will be having coordinated flu vaccination clinics for the campus. That'll happen later this month in early October. We're in the planning stages of that. We've ordered plenty of flu vaccine, and we'll be looking forward to promoting that for our students, faculty, and staff to get back to that point that Mr. Shockney was making just a moment ago. We don't want anybody, any more sickness than we need to have in the community. And by getting a flu vaccine, that will lower your chances of getting seriously ill. So that's our update for today. I'm happy to take any questions. Thanks.
All right. Thanks very much, Kirk. Let's go into questions. First of all, from Dave Askins, the B Square Beacon. The first one for Mayor Hamilton. Will the city of Bloomington, as an employer with over 100 workers, now start requiring that its employees get vaccinated or else get tested weekly, as described in President Biden's announcement? And if so, when will that be put in place?
Well, thanks for the question. I hope so. Actually, it's quite complicated. It's not clear if the Department of Labor rules, which we actually have to wait for those, will cover public employers like us. It's basically announced for businesses. I agree with the concept. And of course, there's a contravening state law. The question of whether the OSHA rules, Occupational Safety and Health Administration out of the Department of Labor, overcome a state law can depend on a lot of things. It's complicated. It may depend on whether you're a delegated OSHA state or not. It's more than I know now, but I would say I look forward to finding that out, whether we can, despite the state law. We'd look forward to working with the county as well as an employer, other government employers, because I think it's the right direction. But we just have to, I don't know the legal impact yet, whether it overcomes the state law.
Okay, next question from Dave Askins for Penny Caudill. Based on the comments at the Board of Health meeting this week, it sounds like the county health department would prefer to put its efforts into promoting vaccination and making vaccine available instead of enforcing a mask mandate, even while stressing the benefits of wearing a mask. What are some of the things that the department would be able to do by way of making vaccine available if it were not burdened with mask mandate enforcement?
Thanks, Dave, for that question. Certainly following up with individuals and doing education and finding ways to make people safer is always preferred over following up on complaints. I don't know anybody here that would say they would rather follow up on complaints than to do something that they felt was maybe more productive. So what we would like is for everyone to wear a mask, whether there's a recommendation or a mandate. If it is recommended or mandated, please wear your mask. We know that masks work. So number one, we want people to mask up while we have high levels of transmission with which we do. In terms of what we could do, there's another question, and I'm going to kind of jump and add it in. I don't know who asked it. Somebody asked a question about the number of people who received a first dose but haven't received their second dose. We could put efforts into reaching out to those individuals, making sure that they in fact did receive their second dose, or making that available to them. We can do more targeted, very specific, kind of time-consuming types of outreach. We know that we spend a lot of time and energy putting together these outreach clinics, sometimes to only do 1 or 2 vaccines. So if we could work with individuals on the front end to ensure that we have a group of people who are ready to take that vaccine, who have their questions answered, then we could be there and know that we are going to provide vaccine for them. So there are lots of ways that I think that we could improve what we're doing in terms of outreach. We are doing a lot. There's a lot that's happening, a lot of outreach, contacting and working with our businesses. We're doing that, but to be able to scale that up and work with them directly, there are thousands of businesses in our community. So it takes a lot of effort to be able to reach out with them and see how we can make sure that everybody in their facility that wants to be vaccinated can be. and can be easily without a lot of barriers to them. So those would be the kinds of things that we might be able to do if people were more prone to follow the mandate, so that we were not in a position to have to spend time on complaints and follow up for those.
Okay, next question is also for you, Penny, from Dave. Will today's announcement from the State Health Department on the partnership with Gravity Diagnostics for testing have any positive impact on Monroe County?
I believe it will. I think that the more testing that we can have across the state, the better off our state will be, and our residents to have easy access. So I will just add that piece the state has been working on, and that has been part of what slowed our contract agreement, our grant agreement that we were expecting. So we do expect some quicker movement now that they have that resolved.
Okay, next question's from Adam Pinsker. This one says, will IU students who don't comply with the vaccine mandate be disciplined? And if so, how many students have been disciplined so far? I'll actually take that one on. We don't have those discipline numbers broken out like that. I don't have a number to give you on that. But of course, any student or any individual, meaning faculty or staff, who does not follow the vaccine mandate, does not follow the compliance. If you are unvaccinated and have an exemption, you're not showing up to testing, you could be subject to compliance measures. For students, that could manifest itself in trying to log into IU computer systems and not being able to access those systems at some point. But as far as individual actions, that would depend on the individual case. And so we're right now really focusing on trying to make sure that we get as many people vaccinated as is possible at this point. And that's where our emphasis is. As Kirk mentioned, there's a clinic coming up where we're trying to get people who have not yet been fully vaccinated. And I'd make the point, Kirk, as Aaron Carroll does often, those vaccination rates can only go up. They're not going to go down.
Yes, that's right, Chuck. And, really to add a little more to that, to be honest, we're really focused right now on tracking where our positive cases are. That's number one right now. Through the summer and up until classes began, we did a yeoman's effort in promoting vaccines. And now we're really focused on finding where we've got little outbreaks and doing our contact tracing. Our teams are working on that and keeping a close eye on that. And when we do find infections, we get those folks advised for quarantine or isolation, depending upon whether they're infectious or just a close contact. I think as time goes on and we're able to get the final numbers in on enrollment, to look at a lot of the bigger picture, we'll have a better idea of exactly where we are on the vaccine rates, as well as compliance rates for testing. That's all going to get more emphasis as the semester goes on. But as Chuck says, what we've really tried to do is focus on promoting the fact that the vaccine is the best way to keep the campus safe and open and up to full speed. Frankly, we need to be encouraging the people that have not been vaccinated, encouraging them that there's a lot of good reasons to get vaccinated. And where we need to be focused, I think, in terms of discouraging people, there are the folks who are spreading the inaccurate and misinformation. That's really where our problems are. Many people have been persuaded by inaccurate information.
Next question from Adam for Penny Caudill. Penny mentioned booster shots. Are those vials being stored here in town, and will they be ready to be administered once the government gives the green light?
Well, if you're talking about like stored, like stockpile, the answer is no, but we are anticipating it will be the same formula But what we don't know is the dosage or exactly the timing for when those booster doses will be advised for individuals. So once we have all of that, if it's approved, and then we have directions, we know what the timing is. So when people are eligible for those, we know the appropriate dosage, then we can start dispensing that vaccine. But we do expect it right now. We expect it to be the same formula that we have. And so it will mean that there may be more vaccine that we need because we'll have a higher uptake. But if it's as long as it's the same formula, we'll just be drawing up the doses as appropriate.
Okay, I'll give a moment here for more questions. We still have a few minutes left, but no other questions in the hopper, but we'll give a moment for that to happen. If you do have any others, links in the chat, if you're watching here live, the IU dashboard is in there at covid.iu.edu. The direct link to our dashboard is in the chat as well. So we do have some questions coming in right now from Patrick McGurr from the HT asking Kirk, can you expand on plans for third shot or boosters at IU?
Yeah, we've been talking about that, but frankly, we're waiting for FDA and CDC guidance to finally come out so that we can follow it like we have all along. So what we're going to do is take a look and say, all right, what is the guidance? And if we determine that the university could help by having this third shot for our faculty and staff, then that, because there may not be enough capacity to do it in the community, then we'd move ahead with some options like that. So we're looking at it just like we are with planning for the flu vaccine clinics and that type of thing. What we'd like to do is get to a point where we'll probably end up in all of this with COVID, is where this is a standard thing that you do annually, like you get flu shots and other vaccinations with your normal healthcare provider, and just get it into your normal rhythm of life so that you can stay safe. But if we need to work on that to buttress what's going on in the community, the university would consider going back to a model like we did last year.
Another question from Patrick Penny. Are other communities dealing with similar testing delays?
Certainly, there was a variety of testing grants and opportunities. And we have 92 counties in Indiana, and we have 95 health departments. I don't think anybody does everything the same way. And so, some counties figured out testing in a different way. Those kinds of things, but certainly we are not alone in our venture. But I am hopeful that we will have something up and going extremely soon. And I do apologize for the delay.
Okay, still have a few minutes left. I'll do one last vamp here as we, this is the only time I ever get to use the word vamp during the week. So I try to take advantage.
I just want to say, Penny, you don't need to apologize for that. You're doing everything possible. I know, we appreciate that. And there are things that get in the way, but thanks for all you're doing. And no apology accepted for that. That's not your fault.
Okay, so going once, and I'll remind you that we are back to a weekly schedule. So we will be back next Friday at 1:15 to again do an update on COVID-19 with all the parties here involved. And we will see you then if there are no other questions, and seeing none, we'll close the proceedings, and we'll see you next week.
And let's hope
Everyone, get vaccinated.
Thanks.